But our parents would rather sit there in pain, dying, than going by themselves, because that's how bad they're afraid to go, because they know they won't be, they do get treated differently. As for my parents, like, they don't like going to the doctor unless I go with them to translate for them. Even if the hospital clinic, like, they say they're gonna have a like interpreter to translate for them, they know it's not the same. And I think that's one of the things that stops them from like going to seek health care. Whenever we first arrive into the doctor's office, or like we're in the waiting room waiting for a nurse or for a doctor, we get treated differently, only because they instantly like think, oh, she can't speak English, she only knows how to speak Spanish. How am I going to communicate with them? And it's just kind of sort of this tension in the environment whenever they first walk in. And it's whenever I speak up and then I speak to them in English, they're like, oh, okay, there's someone in here who can speak English. And just the environment quickly shifts from like a tense environment and like uncomfortable to like, okay, now it's kind of easier for me to, as a physician or a nurse, to communicate with the person who's actually here to be treated. Imagine an immigrant not wanting to seek help, going to the doctor, already receiving that prejudice of like, oh, the language barrier, being treated differently. Just add on top to having a police officer presence there, it just scares them off even more to even seek for help. Like, I can't speak English. I know I'm going to be treated differently once I get to the hospital. And once I see that police officer, they probably much rather turn around and not receive any help at all. And if they're dying, they're dying. They'd rather just go home and die in their home than be caught by a police and be turned into ICE. And it's a very sad situation, honestly, because I feel like the immigrants have to see those kind of things that other people don't have to like factor in.
El miedo que la gente hispana mira a un uniformado.
The problem is whenever Hispanic people see someone in a uniform,
les tienen miedo.
They feel afraid.
Porque automáticamente creen que los van a deportar o que les va a pasar algo. Entonces, ¿qué es lo que está pasando ahorita con la comunidad hispana?
Because they think they will get deported. So what's happening with the Hispanic community right now?
Es que no quieren hacerse las pruebas del COVID.
Is that they don't want to get tested for COVID.
Entonces, la gente prefiere enfermarse en su casa.
So people prefer to be sick at home.
Y hacer medicinas caseras.
And make home remedies.
Y sanarse en su casa. Y si se mueren, pues se mueren.
And get better at home. And if they die, they die.
Early on the fall of last year in late summer, the Health Equity Response Unit, we created a survey for the Hispanic community surrounding the usage of the National Guard to conduct those testing sites. And one thing that we quickly observed was during the survey, the English survey, the individuals that answered those surveys, they had green cards, they were more proficient with the English, so they were more comfortable with the usage of the National Guard versus the individuals that answered the Spanish version of the survey and that claimed to have multiple languages. Their fear was dramatically increased. So that tells us, the comfortability of knowing that you have more security on not being deported. The fear reduces tremendously when it comes to seeing a person of authority around the area while the tests are being conducted.
It goes along the same lines that we see with, even in the Black community, where the historical factor creates an indirect one, mistrust and fear. So, so due to the raids and some other things that have happened to our immigrant populations in the past, when you do see those uniforms, that's where that fear stems from. It's not necessarily that the National Guard did anything wrong or anything to the actual Hispanic community, but just the fear and understanding of what has happened. When you think about services where it requires information like a phone number or address, how that creates a level of nervousness and uncertainty for that. What does it mean if I do, let's say, test positive for COVID-19? Does that put my visa in jeopardy? And then what type of hesitancy does that create? Now they're going to be more likely to participate in different things, but there's still going to be a level of mistrust for anybody that's tied to law enforcement or uniform. It's really cool, key and important that we make sure that we understand that if we improve immigrant access, we improve access for everybody within the community.